Welcome to the newest addition to the Help PANCE PANRE Review, our design learning tracks, which is the last edition of our 2014 upgrade, which has included over 1,000 new facts that you need to know. In addition to an addition of questions, we now total over 4,800 questions. Let's take a look at the design learning tracks and how they are designed, as it may be, to get you exactly what you need to know. The most important thing when dealing with your PANCE and PANRE preparation is the fact that you're dealing with such a gross amount of information that you really need whittled down to exactly what you need to know, and you need some way to deal with this information, packaging in a way that gets in your brain, gives you the associations you need, and helps you sort out, again, such a gross amount of information. So let's start with, let's say, endocrinology. So let's say that's what you need to study today. That's your weak point. You've decided. In addition, we've broken down the blueprint further. This is the entire endocrinology blueprint here, but it's been broken down into subsets of contrast and compare subjects. These are subjects that we say you'll have questions most likely where the distractors are going to be very confusing. In other words, the confusion probably will not come between a diabetes answer and a hypoparathyroid question, but it would come between the difference between hypo and hyperparathyroidism, similar subjects. So we keep you in these subsets where we want you now to take this specific design learning track to get what you need in your mind, and it also allows you to piece up this gross amount of information and break it down in a way that you can deal with. So let's look at parathyroid disorders quickly in the DLT. Once we get to the design learning track page, we see we can open the presentation to full screen. Here's where we start our system for allowing you to break down this information in a way that you'll always remember. The first thing you'll start with is what's called our recall challenge, and in this case you're going to see what your base knowledge is. We have notes pages you can print, and those notes pages will be available to write down these answers. So you'll ask yourself these questions: do you or do you not know just some of the basic things that you need to know about hyper and hypoparathyroidism? Once you go through your pre-tests, you're then going to go to Video Tutor. Now I'm going to skip Video Tutor right now because it takes a little while. I'm going to show you the system, and at the end of this demonstration, I'm going to include an entire video tutor for parathyroid disorder. Once you've seen Video Tutor, which again is an expert guidance through this subject, you can do the interactive learning module itself, which is our patented remind, review, reaffirm system here. So we're going to start again with parathyroid disorders. Here's where we have our standard slide with all the main points you need to know in white, our PANCE PANRE points on the bottom, and then the clouds, which have any information related to these footnotes. So here, if I want you to know about these two signs, this describes them. Okay, and all of our slides are here for your evaluation. These are interactive. You can click on anything that's here on the slide and go to where you need to go, and you can access them at any time you wish. After that, we get to our section synopsis. So we say remind. We go through the information with our interactive learning module. We review it here in a section synopsis, showing you the main points again in a different way so that you remember the main things that we need you to remember for these topics for your exam. Again, showing them in different formats certain times helps to reinforce the information, but also helps different learners. From there, we're going to go to off the charts. Now, these are the same questions you did in the recall challenge in your pretest. This is, of course, with the answers. So now you'll see, did you answer them properly? And of course, while you're listening to Video Tutor or going through the ILM, you'll also be looking for those answers to those questions that you may or may not have known when we went through the initial recall challenge. Once you've completed, we have one more step just to reinforce that you've actually retained this information. So these subsets, these small groups help to break down the information, but it's very important that you leave this understanding that you do know parathyroid disorder or you don't, and you need to go back and study. And by doing so, you can do this set of small true-false questions. Okay? So you'll finish that quiz, and now you'll have two post quizzes which should reinforce in two different ways so that you really understand exactly whether you do or do not understand, in this case, parathyroid disorder. So I'm going to go on now from this point forward. We're going to show you an entire video tutor so you can see the way it flows and see how our system easily cements in your mind exactly what you need to know to pass your exam. In this section, we'll be covering both hypo and hyper hypoparathyroidism. Okay, so we're going to start with hypoparathyroidism. So in hypo, and the first thing I want to say before we go any further is this. There's seldom times that things are easy in medicine, but this is one of them. If we talk about parathyroid disorder, I want you to remember, number one, it's all about calcium, and number two, that they go together. So a decreased parathyroid hormone decreases your serum calcium. And we'll see next that an increased parathyroid hormone increases your serum calcium. So first, remember parathyroid, calcium. Second, remember that they go together. Low parathyroid means low calcium. So everything we're going to talk about our patient's presentation and a question is going to relate to a hypocalcemic state. And we're talking about serum calcium. So let's take a little physiology moment here and just make sure that we remember the way things work, and that there are three organ systems responsible for our serum and urine calcium levels in our body, and they're all affected by parathyroid hormone. So normally when parathyroid hormone is increased and present, we're going to have absorption in the gut, we're going to have resorption from the bone, so that there'll be more serum calcium, and we're going to have the kidney reabsorb or keep the calcium. So this means the urine calcium then will be decreased once parathyroid goes up. So that's the parathyroid physiology. Now, in a hypoparathyroid state, what happens? Well, if there's not enough parathyroid, the gut is going to not absorb as much calcium. The calcium is going to stay in the bone, and it's not going to end up going to the serum. And the kidney is going to let it go. So you'll have an increased calcium in the urine, and you'll have decreased serum calcium in the end. So this is where we are from a physiological standpoint, and how is this going to affect our body? So there's different symptoms. The main symptoms are paresthesia, cramping, fasciculation, fatigue. Now these are difficult because they're not very specific. Now, patchy hair loss, dry skin, brittle nails, guess what? That also can happen in hypothyroidism. So these are not specific things to drag us to one or the other, and therefore probably won't help us determine anything on a question. However, the cramping and fasciculation and paresthesia are specific more to the hypocalcemic state here. So remember, it's any hypocalcemic state that can have these symptoms. There are two signs that are also specific to a hypocalcemic state and therefore would be seen possibly in a hypoparathyroid patient. It's Trousseau's sign and Chostek. So you need to know these. And Trousseau's is exactly as it says here, carpal pedal spasm with inflation of a blood pressure cuff greater than the systolic pressure, whatever it is, for greater than 3 minutes. So in carpal pedal, you can do it on the arm, you can do it on the leg. So we have spasm in the hand or foot, and it's related to the blood pressure cuff being elevated greater than the systolic pressure. In Chostek, you're tapping the same side of the face, and you're going to see this little twitching that occurs in the face. There's some good YouTubes you can look for both of these. Either way, we're going to look for treatment which is the same, which is replacement of the calcium. Now, it's true people who are significantly hypoparathyroid can be very, very sick, and we can see these type of symptoms here. We don't expect that, but you can put seizure together along with Parkinsonian symptoms in those cases. So again, our treatment is oral calcium and vitamin D to keep the serum calcium greater than 8. So remember, a serum calcium greater than 8 is your goal in treatment of hypoparathyroidism. The main cause is surgical removal or trauma, so we're not going to be able to replace that. And I also want you to remember too, radiation to the neck and chronic hypomagnesemia. Remember that phosphorus and magnesium and calcium, phosphorus and magnesium, they really can't be separated in the way they're dealt with, and they affect each other. So chronic hypomagnesemia I also want in my brain as a cause of hypoparathyroidism. If we talk about hyperparathyroidism, well, now it's the exact opposite of what we talked about before. So if we look at our little diagram here, the difference is, obviously, we have increased absorption of calcium from the gut. We're making the gut work more. Remember that. We're making the gut work more, so maybe we'll get some abdominal pain and cramping. We're actually increasing calcium resorption. So more calcium is going from the bone into the blood, so I can have osteoporosis. And in the calcium side with the kidney, we're dealing with increased resorption, so we're keeping it, and we're not having as much in the urine. So when we look at this as a clinical presentation, what are the presentations we talk about? Bones, stones, abdominal moans, and psychic groans. Osteoporosis, renal calculi, bone pain, GI symptoms, depression, and psychosis. All right? So like we said, think it out. If I'm making my gut absorb more, I get the GI cramping. It's usually an abdominal cramping. Osteoporosis, because I'm letting the calcium leave my bones. Renal calculi, because of what's going on in the kidney. Remember, they go together, so increased parathyroid hormone means increased hypercalcemia or increased calcium. Now, we do need to differentiate in our mind the difference between hyperparathyroidism, which is primary, and which is secondary. So in hypoparathyroidism is almost always primary due to destruction or trauma to the gland or surgical removal. But in hyperparathyroidism, it is either primary or secondary. Now, primary can be adenoma, hyperplasia, or malignancy, which is extremely rare. But secondary is the most common cause here. And the most common cause of secondary hyperparathyroidism is chronic kidney disease. And this results from the body's inability to convert vitamin D because the kidneys are obviously ailing. Without conversion of vitamin D, it doesn't work properly. The body cannot absorb calcium properly. It results in a short-term hypocalcemic state, which there in turn causes a hyperparathyroid state in an attempt to raise the calcium levels. So chronic renal failure causes chronic secondary hyperparathyroidism. Now, anyone with hyperparathyroidism for a prolonged period of time can have osteoporosis, and those treatments may include bisphosphonates, denosumab, or teriparatide, and that will be covered in orthopedics. Treatment of our hyperparathyroid state depends on what's wrong. So if it's a primary hyperparathyroidism, surgical removal 90% of the time. If it's a secondary hyperparathyroidism, we need to address the underlying problem. Now, if it's chronic kidney disease, we can't fix that, so we're going to be looking for medications. If it's chronic calcium or vitamin D deficiency, obviously we can address those deficiencies. So remember, it's surgical removal if we're talking about a primary, but that if we're dealing with secondary hyperparathyroidism, we're probably going to be looking at these medications. Now, Sinusolette can be used for either. It's still mostly used for secondary. Paracalcitrol can be used only for secondary, and these are both very commonly used in end-stage renal disease. So remember what we said, these specific symptoms: bones, stones, abdominal moans, and psychiatric overtones. So how do we differentiate a hypo or hyperparathyroid? Number one, remember, low hormone, low calcium, high hormone, high calcium. Remember that, please. Remember those specific symptoms to either hypoparathyroidism. We can see, if you want to remember, tingling, tetany, Trousseau's. That might be an easy way to, in an alliteration, to remember. And that it's Trousseau's and Chostek's sign. Remember that it's these guys I'm more worried about because these can be common to other disorders and may or may not help you on the question to differentiate where you're going. Remember bones, stones, abdominal groans, psychiatric overtones, however you want to remember these guys here, very important with hyperparathyroidism.